Well, good morning, everyone, and welcome to this contact webinar. If there's any technical hitches, please do bear with us. We'll try and resolve those as quickly as possible. But if you're joining us by PC, by laptop, tablet, or smartphone, hopefully you should now be able to see this introductory slide. My name is Derek Sinclair, and I'm the Senior Parent Advisor on Contact's Family Finance team. And we provide detailed advice and information on all aspects of claiming benefits and tax credits for families who have a disabled child. I'd like to start first just by saying thanks very much for taking the time from your busy schedules to join us this morning for this morning's webinar. We know that you've got a lot of other pressing matters to deal with, so we really appreciate you taking the time to join us this morning. Now, this session is going to be providing an overview really of the main benefits that can be claimed by families for a disabled child who's aged between sort of 16 and 19 or 20. By the end of today's session, you should have a better understanding of the process that's involved in moving from DLA to PIP and what the main differences between those benefits are. And hopefully you'll also understand when you can continue to claim benefits for a young person as a dependent of yours, as part of your family, so benefits like child benefit, tax credits, and so forth. We're also going to be spending a bit of time at the end of the session looking at when a young person may be able to claim benefit in their own right, and these days that always really means making a claim for universal credit in their own right. We may not be able to answer all of the questions within the time we've got, and if that happens, I will summarize any of the questions we get, post questions and their answers as part of a news story that we'll have on our website and on our social media channels early next week. Of course, if you are looking for advice more urgently than that, you can access advice on benefits via our web pages, and we do have a specific web page on benefits at 16, or you can get in touch with our free helpline and you can get individual advice by speaking to an advisor directly, and we do have specialist benefits advisors that you can access via the contact helpline. At the end of today's webinar, a short questionnaire will launch. Please take the time to complete that. It really is helpful for us in planning sort of future webinars and other online training events. So we're going to start today by looking at personal independence payment. This is the benefit that replaces DLA for adults. So what will happen is that any child who's in receipt of DLA is going to be invited to claim PIP shortly after their 16th birthday. And although it's an invitation they really can't refuse, because if you don't claim PIP when you're invited to do so, I'm afraid that your DLA payments do end. Now, this applies to all children really, with only two exceptions. So if a child is claiming DLA under the special rules for the terminally ill, then they will be exempt from the requirement that they move on to PIP. And if a child is in hospital, so if they're an inpatient on their 16th birthday, they're not going to be asked to claim PIP until after they've been discharged. But other than those two groups, everyone who lives out with Scotland is going to be asked to make a claim for PIP at some point after they turn 16. There are different rules coming in Scotland, but we don't need to worry about those today. Okay, so what this means is even if your child has an award that's due to run, say, to their 17th birthday, or if they have an indefinite award of DLA, that doesn't really count for anything. When your child turns 16, they're still going to be invited to claim. What will happen is, as long as they're taking part in that process and engaging in the process of getting a PIP assessment done, then their DLA award will temporarily continue. But once the PIP decision's in place, then that will replace the DLA award that your child has. Now, normally you'd be invited to claim PIP really quite quickly after your child turns 16. What happens is usually after a week or two, you get this letter through requesting that you make a telephone call to the PIP claim line and you start the process. Something different is happening during the coronavirus outbreak, though. They have, for the last 3 or 4 months, really postponed all PIP assessments. So what's happening at the moment is where a child's turning 16, the DWP will be telling you, actually, you don't need to start the process of claiming PIP yet. We're just going to continue your DLA award temporarily, and we'll be back in touch at a later date to ask you to claim PIP. The last sort of official notification we had from the DWP was that in July, where they said that they were still suspending all PIP assessments, but they were hoping to start the process of reopening them over the next 2 months. So we expect shortly to start seeing people being asked to take part in the assessment. So what happens when your child's asked to claim PIP? Well, there's really 3 distinct stages to claiming PIP. So the first thing that will happen is before your child actually turns 16, you will be contacted in writing by the DWP, and they will basically tell you about the process that's going to be happening, and they'll ask you in advance whether you think your child is able to manage their own benefits or whether they would need someone to manage them on their behalf. Now, after your child turns 16, the first step then is that you will receive a letter requesting that your child, or you, if you're acting on their behalf, phone the PIP claim line to start the process of claiming. And a lot of parents get quite worried about this phone call. They're told that a claim form is going to be completed over the telephone, and they're worried that they might not answer it very well, and the questions that might be asked might be detailed questions about your child's care and mobility needs. But actually, you don't need to worry about those things during this call, because the actual form that's filled in at stage 1 is a very basic form. It'll only take about 20 minutes to complete, and it's really just asking questions about your child's ID, who the doctors are that are involved with your child, what school or college they attend, and it just checks that there are not certain barriers to them claiming, like they don't have any immigration restrictions. Once the DWP are clear that your child potentially is entitled to PIP, they then start stage 2, which is to send out a written questionnaire that you or your child will have to complete and return by a certain date. You're usually given a month to do that, to return the form. You can ask for an extension, although it wouldn't automatically be granted. Again, during the coronavirus outbreak, people have been getting longer to return the forms. We'll have to wait and see if that continues to be the case moving forward. Now, this stage is perhaps the most important part, because this is really a self-assessment form that's asking you to describe, or asking your child to describe, what sort of difficulties they have in terms of needing physical assistance, needing supervision, needing prompting to undertake certain tasks. And it's really important that you spend a lot of time making sure you put a lot of detailed information into that form. It's the equivalent to the DLA claim form in effect. At that point, you can also submit additional evidence in connection with your claim. If you've got supportive letters from consultants, from GPs, from other professionals for a school or college, you can submit it at stage 2. Now, normally there's a stage 3, so most people are also asked to have a consultation with a health professional. So this isn't your own doctor or a consultant, it's a health professional, probably not a doctor, probably a nurse or an OT or a physio who's employed by a private company, which will either be Capita or something called Independent Assessment Services, which used to be known as ATOS. Which company deals with it will depend on where in the UK you live. Now, currently, there are no face-to-face consultations taking place. So if your child is having a claim assessed anytime soon, the likelihood is that either there will be no stage 3, they'll either make a decision just based on the paperwork, or any consultation will be done over the telephone. Now, your chances of having a decision made just on the written evidence is going to be much stronger and much better if you've provided additional evidence at stage 2. So, you know, I know it's not always in your control. You may not have regular contact with professionals anymore, but if you do, it can be worth the effort of trying to get some supportive evidence. Although you don't just send a report just because you have one. You have to look at it and make sure that you believe it's going to be supportive of your child's claim. So for those people who've dealt with DLA, on a superficial level, PIP does look really similar. It looks and feels very similar to DLA. So it's got two components, a care component and a mobility component, which are obviously the same as DLA. The care component is called the daily living component, but it's very similar, and it's measuring the need for you know, supervision, care, physical assistance, and prompting. It's not means tested. The benefit can be paid to disabled workers and to people who are out of work. There are special rules for terminally ill claimants. There are special rules for people who are in residential care about when they can and can't be paid. It's also a gateway to other help, like certain rates of PIP can allow you to qualify for a Motability car. You can get extra tax credits for a dependent young person on PIP. You might qualify for carer's allowance if your child is on certain rates of PIP and you meet certain other tests. So all of these rules are almost identical to what happens with DLA. But these similarities are quite superficial, and if you scratch beneath the surface, you'll actually see that PIP is very different in a lot of very meaningful ways. So for example, if we look at this daily living component, that's the equivalent to DLA care, there's only 2 rates of the daily living component, and while there's 3 rates of the DLA care component. So under PIP, there's an enhanced rate, which is equivalent to the higher rate of DLA care and is paid at the same rate. And there is a standard rate of daily living, which is the equivalent to the middle rate and paid at the same rate. But there is no lower rate of daily living component. So if you have a child who's on low rate care, I suppose straight away there's an increased risk that you could be worse off in that move onto PIP. There's also under DLA certain groups of people who qualify for certain rates of DLA automatically, like people who are registered blind or deaf blind or double amputees. And there are no sort of automatic entitlements for any groups under PIP other than people with a terminal illness. With DLA, your chances of getting the higher rate of the care component is conditional not just on how much care and supervision your child needs, but when it happens, because you need to show that your child not only has daytime needs, but also nighttime needs. But under PIP, that doesn't matter. They're not interested in when the needs are. They don't care whether it happens by day or by night. PIP only looks at the types of care your child needs and how severe their needs are. Now we've already mentioned that there's big differences with the assessment process, with the possibility of these consultations with a health professional, but more fundamentally than that, there's actually different criteria. DLA and PIP are not necessarily measuring the same things. And one of the things that's very different about PIP is it actually uses a scoring system. So there's a points-based system, and what determines whether your child gets PIP and what rate they get it is the number of points that they score. Now, DLA, for all of its faults, it's actually quite a holistic assessment. With a DLA claim, they are willing to look at any care needs that your child has, any need for extra attention that's linked to any bodily function at all, and any supervision needs that are attached to, that are caused by their condition. You know, in essence, what they're doing is comparing your child with the average child who has no disabilities. And if you can show that your child has substantially greater care or supervision needs, no matter what they are, then you've got a good chance of getting an award of DLA. But PIP is a much more targeted assessment, in particular the daily living component. And there are only specific areas that the DWP, or in Northern Ireland, the Social Security Agency, will take into account when they're assessing your child. And these are the 10 areas that they look at. And these are the 10 areas that they see as being most important for independent living. So it ranges from things like being able to prepare food, to washing and bathing, dressing and undressing, being able to communicate verbally to others, being able to mix socially with others, and being able to make budgeting decisions for yourself. So these are the areas that are looked at in terms of your child's daily living activities, and these are the only areas that are looked at. Your child could have very severe difficulties with a different issue. Let's say, for example, your child's got great difficulties in getting in and out of bed or in and out of chairs by themselves without physical assistance. It doesn't matter how severe that problem is, it's not actually going to be taken into account at all under the PIP assessment because it doesn't fall under one of these activities. Okay, so with all of these areas that are looked at under daily living, what happens is that the DWP are going to basically look to see what sort of physical help, what sort of prompting and what sort of supervision your child requires in order to be able to reliably undertake these activities. And this word reliably is really important in PIP because the test is not whether your child can do these things as a one-off. The test is whether your child can do these things reliably, which means as many times as is necessary. It means that they can do it safely. It means that they can do it to an acceptable standard. And it also means that they can do it in a reasonable amount of time. So the DWP go through each of these areas in turn. They will score your child a particular score depending on how severe their needs are and how much extra help they require. So if we take an example here, if we take the first example, which is preparing food. So under the PIP system, basically, this test, preparing food, it's really about the ability to prepare and cook a simple meal for one person using basic ingredients. So it's not just about slamming a ready meal in the microwave. There's going to be some preparation involved, preparing vegetables or whatever. So the test is, can they both prepare and cook a simple meal? So if they can do that without help, their score in this activity is going to be 0. If they need to use an aided appliance, they'll get 2 points. If they can cook but need to use a microwave rather than a conventional cooker, they'll score 2 points. If they need prompting to cook, they also will score 2 points. But if they need supervision or if they need physical assistance to reliably prepare and cook a simple meal, they'll actually score 4 points. And if they can't prepare and cook a meal, even with prompting, supervision, and physical assistance, then they'll score 8 points. So the DWP go through this with each of the different activities, and your child will get a score for each of those activities. And the score could be 0 for some of them. Now, just if your child qualifies or meets more than one of the descriptors, so if my child needs both prompting, which scores 2 points, and supervision, which scores 4 points, they get the higher of the two. So they get 4 points. They don't get 4 plus 2, okay? So once all of the scores have been added together, the DWP then total the score. If your child scores between 0 and 7 points, they don't qualify for that component of PIP. If they score between 8 and 11 points, they will be awarded the standard rate. And if they score more than 12 points or more, then they'll get the enhanced rate, which is equivalent to the high rate. So there's also 2 mobility activities that are looked at in terms of your entitlement to the mobility component. It's the same scores that apply, so 8 points and you get between 8 and 11 points and you get the standard rate. If you get 12 or more, you get enhanced rate mobility. There are only 2 activities for mobility: moving around, which is about just being able to get up and walk a certain distance. Now, controversially, under PIP, to get 12 points under that descriptor, you need to show that you can't walk more than 20 meters. Now, the equivalent test under DLA to qualify on the basis of being virtually unable to walk and to get the high rate mobility is 50 meters. So we do have a risk that some people who can walk more than 20 meters but less than 50 meters may actually end up being worse off under PIP. But then we've got another test, which is about the ability to plan and follow a journey. And we see lots of young people who score more, who actually do better in terms of this test than they do under the equivalent DLA test. So the test of planning and following a journey is about being able to plan a route from A to Z yourself, and then also being able to reliably follow that journey yourself without another person helping you. And if you have difficulties in doing that, whether it's because of learning difficulties or sensory impairment or autistic spectrum disorder or mental health issues like panic attacks out of doors, you can score points for the need for someone to go with you on journeys, for example, to make sure you're safe. And interestingly, if someone cannot plan and follow the route of even familiar journeys, without another person's help, then they'll score 12 points, which means they'll get the enhanced rate equivalent to the high rate mobility under DLA. And arguably that's a much easier test than the current test of severe mental impairment under DLA, which requires someone with learning difficulties to have challenging behavior and disruptive and extreme behavior, and also to be having nighttime care needs. So it's a much simpler test under PIP, and there are some children who do much better under PIP mobility than they do under DLA. So the message here is that there are winners and losers under PIP, and it's difficult sometimes to predict who those people are going to be. Certainly there are lots of people who have been worse off, but we certainly see some large numbers of severely disabled children who either get the same rate or who actually can do slightly better under the PIP assessment. What I would say is absolutely crucial is that you familiarize yourself with the PIP scoring system before you even think about sitting down and completing that PIP questionnaire. You really need to make sure that you've got a good sense of how the scoring system works, because the questionnaire, effectively, you are self-rating. You're rating your child, and although you're not aware of it, you're scoring your child by the answers that you give in that questionnaire. So it's really important that you familiarize yourself with the scoring system so you're clear before you start filling the form in where you're likely to pick up points, and to make sure that you provide lots of information around those particular questions. Now, to familiarize yourself with the scoring system, you can do that in various ways. There's a number of publications that have the scoring system set out. Our own guide to PIP, which is available free online on our website at contact.org.uk. It has the full scoring system set out in the middle of the publication. Many other guides are available from other organizations. I want to say something about a website that's I think is particularly good. It's called pipinfo.net. It's aimed predominantly at advisors, but I think it's really useful for families as well. It sets out the scoring system in detail. It really breaks it down, tries to make it plain English in terms of what the actual tests are about, and also has links to useful case law where the courts have already said how some of the tests should be interpreted. Before we move away from PIP, I just want to say a little bit about appointees. So I'd said earlier that if you're claiming before your child turns 16, that you will be contacted by the DWP or Social Security Agency in Northern Ireland, and they will ask you, look, this is what's going to be happening. Your child's going to be asked to claim PIP at the age of 16. Will they be able to do this themselves, or do they lack the capacity to do it? And that is an issue that has to really be addressed before they turn 16, because the DWP need to know who are they dealing with once your child turns 16. Is the claim being made by your son or daughter in their own right, or are you still acting on their behalf? Now, there is a process for sorting this out. So the starting point is to understand that the law actually presumes that any 16-year-old should be able to manage their own benefits. But it also recognises that there'll be circumstances where that doesn't apply. And because of that, it is possible for somebody, usually a parent, to be made their appointee. That means that you're given the power to claim benefits on their behalf and to manage their benefit payments. But you can only be made an appointee if you can show that your son or daughter lacks capacity. Now, that almost always means that they lack mental capacity, although in extreme cases, it can mean perhaps that a child lacks the physical capacity. What is clear, though, is that an appointeeship will not be granted simply because it's more convenient to everyone who's involved, nor will it be granted simply because you don't think your child has the maturity to spend the money wisely, or because the young person themselves would rather not have the responsibility of claiming. None of those are good enough reasons. It has to be granted on the basis of capacity. Now, what normally happens is during normal times that the DWP will organise someone from the job centre to come out to visit you at home, to interview you, hopefully also to see your child, in order for them to make some sort of assessment about whether an appointee is necessary or whether they agree that an appointee is necessary. I mean, at the moment, there are no face-to-face visits really happening because of the pandemic. I'm assuming that if there are appointee decisions being made at the moment, they're being done via the telephone. If you are made appointee for PIP purposes, it's really important that you keep a copy of the paperwork confirming that, because at some point in the future, you're probably going to also want to claim other benefits, i.e. universal credit for your son or daughter, and also want to be their appointee there. Often parents report difficulties getting universal credit to accept that they're already an appointee. It will help if you have that paperwork. The guidance to the DWP says that they should accept for universal credit purposes an appointeeship that's been made for PIP unless they have reasons to doubt that the appointee is still valid. So having that piece of paper confirming it will help get rid of any barriers further down the period of time where you look to claim other benefits. Importantly, being an appointee doesn't confer wider powers to manage your child's affairs. You know, if your child does have other income or capital, you know, if they're fortunate enough, for example, to be left money in someone's will, being their appointee doesn't mean you can manage those assets for them as well. If that's an issue for you, you would have to get legal advice about getting wider powers, such as a financial deputy or something of that nature. Okay, so I've covered as much as I intended to do about PIP just now, so I'm just going to take a few minutes just to see what questions have come in, if any. If you can just bear with me a second while I have a quick look. Okay, so we've had a couple of questions coming on similar issues about difficulties in getting additional evidence for PIP. Obviously, because of COVID, I suppose families are having difficulties in reaching out to professionals for supportive evidence, and parents asking, is that going to be a problem for the PIP claim? Well, although getting additional evidence is helpful, and it certainly will maximise the chances of you not perhaps having a consultation for your child, I mean, it's not a requirement. I suppose even if you don't have supportive evidence, as long as the PIP assessment, the questionnaire itself, is really detailed and really clear, you know, they may well agree to make a decision without the need for a face-to-face consultation happening. I suppose we have to look at it from the DWP's side. They're going to have a huge backlog of PIP assessments to do. They basically postponed all PIP assessments for the last 3 or 4 months, so they're going to have a huge backlog to work through. So there's a good chance that they may well be looking for an excuse to make decisions on PIP claims just based on the paperwork. So, you know, fingers crossed that as long as you provide, you know, detailed information in the questionnaire, and obviously it seems clear that your child is very severely disabled, you're probably going to have a very strong chance of a decision being made just on the paperwork itself. So I've also got a question for Miranda, who's asking, her son's DLA letter says that it runs out on his 16th birthday, actually on the day before he turns 16. And she's a bit worried that the PIP assessment process could take several months. And does that mean that there might be a gap where the DLA stops and there's then a wait of several months before the PIP kicks in? Well, actually, that's not really a worry, Miranda. What happens is if your child, as long as your child's claim runs at least until the day before their 16th birthday, then what will happen is, as long as they're complying with the invitation to claim PIP, DLA is basically temporarily extended. So these rules automatically kick in that say, okay, although your award was due to run out the day before your child's 16th birthday, it's just going to be extended until the PIP assessment has been completed and a decision has been made on the PIP claim. And then whatever that PIP decision is, once it's made, it then replaces the DLA. So yeah, there shouldn't be any problem there with the gap. The only cases where we've seen some problems is where we've had a few cases where, for bizarre reasons, someone's DLA award runs out like a few weeks before their 16th birthday. And we've had some cases where people, and I'm not sure why that's happened, whether it's just been an oversight on the DWP, but we've had some cases where the DLA is going to run out, weeks or months before their 16th birthday, and parents are asking us, well, is it worth me making a renewal claim here because I'm just going to have to reapply for PIP anyway? Well, the answer to that question is you definitely need to reapply, get a renewal in for DLA if it's going to run out before the day before your child's 16th birthday. It's really important because you need to have an actual award of DLA in place the day before they turn 16 in order to benefit from this extension. So that's a really important issue. Okay, we have had a lot of other questions come in. I'm going to keep some of them to later on in the session at the end. I'll run through some more of the questions, but I'm going to push on a little bit about and looking at some of the other content. So we've talked about the move from DLA to PIP, but what happens to other benefits that you might be claiming for your son or daughter during the period where they're 16 to 20? Well, essentially you've got two options really. If the young person is remaining in what's called full-time non-advanced education, then you as their parent has the option of continuing to claim benefit for them as a dependent, as part of your family. So that means you can continue to get child benefit. You might, depending on your circumstances, get tax credits, payments for them. You might, if you've moved on to universal credit, get additional child payments for them as a dependent child. The alternative is that your son or daughter might be able to claim benefit in their own right as a young adult. And these days, that almost always means making a claim for universal credit. Now, there are barriers to doing that if your son or daughter is still in education. It's not impossible, but it's quite complicated and there are lengthy delays in the process. And we'll talk about that a bit later. What you definitely can't do is both of these things at the same time. You cannot claim benefit for your child as a dependent at the same time as they're claiming as a young adult in their own right. So if they claim universal credit as a young disabled adult, it will bring to an end any child benefit, any tax credits, any other payments that you get for them as a dependent. So what's the sort of circumstances where you might continue to receive benefits for your child as a dependent? Well, first thing to say is that if your child has not yet reached the September after their 16th birthday, then they're automatically going to be treated as a child. So between their 16th birthday and the end of August after they turn 16, they're treated as a child regardless of whether they're in education or not. And that means that you can continue to claim benefits for them as a dependent. Once they reach the September after their 16th birthday, it then becomes more complicated. And whether or not you can continue to claim for them as a dependent will depend on what they are doing, and in particular, whether they're staying in full-time non-advanced education. Now, I need to say something here, particularly about tax credits, because if you have a child who is between the ages of 16 and 19, you need to be aware that every summer, the tax credits office assume that that young person is going to be a school leaver, and they automatically set up the tax credit system to stop payments for your son or daughter on the 31st of August. And what happens is that you as a parent have to contact the tax credits office during the summer to actively tell them that your son or daughter is going to be remaining in full-time non-advanced education and to confirm details of the course. And that will then allow the payments to continue. But every summer, at the end of every summer, we speak to numerous parents who suddenly had a big drop in their tax credits and they don't understand why. And it's because no one has told tax credits that the young person is actually staying on in full-time non-advanced education. Now, what does that mean? What is full-time non-advanced education? How do you know whether your child's in it or not? Well, the good news, it's all defined in the regulations. So full-time means more than 12 hours a week. Non-advanced is about the level of course that your child is doing. So if they're doing GCSEs, if they're doing A-levels, if they're doing a BTEC course, those are all non-advanced. If they're on a vocational course that's below NVQ level 4, then that's going to be non-advanced. If they're on a course where there's no qualification, they're doing some sort of life skills course, it's non-advanced. But if they move it to university, if they're doing a diploma course, I'm afraid the benefits you get for them as a dependent will stop because that's advanced education. Now, the activities that your child is doing must be classed as education. Normally, the rules say that must be provided at a school, college, or recognized educational establishment. It does include certain types of approved training in Wales or Northern Ireland. And it also can include education provided elsewhere, so long as it's approved by the DWP or the relevant agency in Northern Ireland. Now, what that means is that home education can count as long as it's approved by the DWP. Now, once upon a time, the policy of the DWP was only to accept home education that started before the age of 16. But that was challenged in the courts some years ago, and the government lost that case. So as a result of that decision, they should also consider approving home education that starts after the child's 16th birthday, as long as you can show that the home education is being provided because of the child's disability or special education needs. Now, in England only, education or full-time non-advanced education also includes what's called a study program. So these are sort of programs that are developed for children taking into account their age and their special education need. And if they're provided under the Education and Skills Act, then they count as well, no matter where they're being provided. Now, I want to say something just very quickly about temporary interruptions in education, because we come across lots of cases where families phone us saying their child is unable temporarily to attend school because they're unwell or because the course is proven not to be suitable and the course is broken down. And in many cases, the DWP, where they find out about this, just seem to assume that the young person's left education permanently and stop the benefits that are being in payment. But there are rules actually in both child benefit and child tax credit that say they should ignore a temporary interruption and continue to pay these benefits. Now, an interruption can be ignored for up to 6 months if it's caused by reasons other than disability, but if it's due to a young person's illness or disability, there's actually no time limit. It can be ignored for as long as is reasonable in all the circumstances. So, you need to make sure that if you do have a situation where your child has to come out of education, but it's only temporary, and they're going to be returning to non-advanced education, The plan is that that's what they're going to be doing as soon as they're well enough, or as soon as a new course can be organised. Then you need to make sure you tell HMRC that and specifically ask them to consider the claim under the temporary interruption rules. Now, these rules can apply for child tax credit and child benefit, even if your child is going to be going back to a completely different course. As long as it's non-advanced and full-time, it doesn't have to be the same course. The rules are more restrictive if you're claiming universal credit for your child. If they are abandon the course or asked to leave the course, I'm afraid even if they then start another course during that temporary interruption, they're not going to be treated as someone you can claim universal credit for. The rules are quite complicated, but we are via our helpline can provide quite detailed information if you run into any problems there. So just to recap, when must you give up payments for a young person who you've been claiming for as a dependent? Well, if they've reached the age of September after their 16th birthday, and they then cease full-time non-advanced education. So that could be that they give up education altogether. It could be that they move into advanced education, or it could be that they go from full-time to part-time education. The only exception to that really is some 16 or 17-year-olds, if they register with Connections or the Career Service as someone who's available for work and training, sometimes those benefits, child benefit tax credits and so forth, can be extended for a 20-week period. Even if your child stays in full-time non-advanced education, there will come a point where they simply run out of road, where they become too old for these benefits to be paid anymore. For child benefit and child tax credit, that's when they reach the age of 20. If you're claiming universal credit for your child as a dependent, it will be the September after their 19th birthday. But just to reiterate that even if they stay in education, if they're fortunate enough to get an award of universal credit in their own right, that will bring the payments you get to an end straight away. So what payments might you lose? Well, not only child tax credit and child benefit. If this is your only child that we're talking about, you might lose working tax credit. Depending on your circumstances, housing benefit and council tax reductions might also be affected. If you're claiming universal credit for your child, then you'll stop getting payments for them as a dependent. And also some families find that they lose an exemption from the household benefit cap. So out of work families often have a cap on how much total benefit they can receive in any 1 week. But certain groups of people are exempt, and that includes where you have a disabled child on DLA or PIP. But if your son or daughter claims in their own right, you cease to be treated as having a dependent child on DLA or PIP, and therefore could potentially lose your exemption unless you qualify on some other grounds, like being in receipt of carer's allowance. I just very quickly want to say something about 19-year-olds. I've said all along that if your child's between the ages of 16 and 19 and in full-time non-advanced education, you can continue to claim for them. It's slightly more complicated during your child's 19th year because, strictly speaking, what the rules say is while your child's 19, they can continue to be paid if they're on a course that they either started before they were 19 or they were accepted or enrolled onto before their 19th birthday. So there is a risk that if your child starts a new course midway through their 19th year, that the HMRC might say, well, we're going to have to stop making payments because the new course is not one that they were accepted or enrolled onto before their 19th birthday. In practice, often HMRC are more sympathetic than that, though, and often they'll actually, as long as there's no gap other than the school holidays between the new course and the old course, they'll sometimes treat the new course as if it was an extension of the old course and therefore continue to pay. That's something that they used to do in most cases. It seems a bit more hit or miss these days, and if you do run into problems around that, just come back to us for further advice. So I'm just going to take another break quickly just to see if there are any other pressing questions to answer before we move on to looking at universal credit. Someone's asking about whether there are any sort of sample answers available for filling in the PIP form as there are for DLA. Kalina is asking about that. There are a number of organisations that produce guides to help people fill in the DLA form. And Kalina's asking, are there similar ones for PIP? Well, there are some, not as many, I think, but there are a few organisations that do it. I mean, the starting point, I guess, is if your child has a specific condition, is to look and see whether there are any rare disorder support groups who produce a guide specific to that type of disability. There are, you know, other organizations that do more general guides. There are some that you have to pay for. There's one in particular I'm thinking of. There's a subscription service that has a very detailed guide. I guess people have to weigh up whether it would be worth doing that. I mean, organizations, the local advice services, even though a lot of them have closed their doors, can provide advice over the telephone. And you know, people like CAB, like Welfare Rights Services, helplines such as ourselves, we can provide advice over the phone. What we can't do is fill in a whole PIP form or questionnaire for someone, because that would take up too long. But you know, where people are able to fill in as much as they can, you can phone helplines such as ours and get more detailed advice. And it's probably better doing that because you'll get more individualized advice about how best to try and fill in the form for your child. Somebody else, Wendy's asking, is lack of communication skills a good enough reason for an appointee to be made? Well, I think if it's just a sensory issue in terms of communication, I don't think so. There would have to be, you know, a level of cognitive impairment there. It's about whether the young person really understands their understands how money works, understands how the benefit system works, understands their responsibilities as a claimant. Because if you claim benefit, that has certain responsibilities that come with it. So where someone has difficulties in communication, I think that in itself is probably not going to be enough. They would have to be linked to some sort of learning difficulties where you were able to argue that the person lacked mental capacity. Now, Nawel's also asking, could I please explain a bit more about universal credit, which I think I'm going to do now. There are lots of other questions, and I will, as I say, the session may well run on well beyond 11:30, and you know, after I've finished all my content, I'll try and answer as many of these questions if you're able to stay on. Okay, but let's go ahead to look at universal credit. Now, before I do that, though, I just very quickly want to say something about another benefit, which is employment and support allowance, because a lot of people phone our helpline and they say, can I claim ESA? I've heard that it's a benefit for young disabled people. Well, once upon a time, that was the case. Lots of young disabled people did successfully claim ESA, but I'm afraid these days it's highly unlikely that your child will be able to get that benefit. There are two types of ESA, new style ESA, which is contributory, which would mean that your child would have to have worked and paid national insurance, usually over a 2-year period, before they would be able to qualify for that benefit. And simply, very few children would ever meet that test. The other type of ESA is income-related ESA, which is a means-tested benefit for people who are unfit to work. But with very limited exceptions, that has now been replaced for new claims by universal credit. The only people we see who are still potentially able to claim income-related ESA are those young people who are already on another means-tested benefit, such as housing benefit. And really, I would say the only new groups of claimants who could get round the barriers to claiming income-related ESA are those who are in supported accommodation. I'm not going to go into the detail of it in this session, but if you do have a child who's in supported accommodation or likely to be going into supported accommodation in the next 3 or 4 months, then I think you should get urgent advice from the contact helpline. about the possibility of claiming income-related ESA rather than universal credit. Now, for everyone else, though, I'm afraid if your child wants to claim benefit in their own right, the only real game in town these days is universal credit. It's a new benefit that is for people of working age, and it has replaced all of the means-tested benefits, all new claims for all of the means-tested benefits. So you can't make a new claim for income support, for tax credits, for housing benefit in most cases, for income-related ESA. You're told you have to claim universal credit instead. It's now been rolled out across the whole UK, so it doesn't matter what your postcode is, you live in a universal credit area. It's means tested, but it's means tested on your child's circumstances, not yours. Normally, you must be aged at least 18 to make a claim for universal credit, but special rules say that you can claim as a 16 or 17-year-old as long as you have medical evidence from your GP, something called a fit note. It's just a medical certificate. But the big thing to be aware of about universal credit is there's some major barriers to claiming if you're still receiving education. Now, let's look at the process if you're not in education anymore. So if your son or daughter's left education, then it should be fairly straightforward in some respects. Well, as straightforward as it can be. So you would claim online normally via the .gov.uk website. You submit fit notes from your GP as part of that process. You definitely want to be submitting fit notes if you can, because if your child's 16 or 17, it's necessary or they'll be refused. But even if they're over the age of 16 or 17, unless you want them to be claiming universal credit as a job seeker and signing on as available for work, then they need to be claiming on the basis of ill health. And the way they prove that that's the type of claim they're making is by having these fit notes. They will have an interview with a DWP staff member called a work coach, normally done face-to-face at the job centre, just now being done via telephone calls during the lockdown. If your child is accepted as entitled to universal credit, they'll start to be paid. For someone who's 25, single with no housing costs, it's about 70 odd pounds a week that they would receive as a standard rate, assuming they have no savings above 6,000 and no income other than PIP. As part of the claim, they will be asked to complete a questionnaire and undergo an assessment. This is not the same questionnaire and assessment as PIP, it's a different one. It's similar. It's something called a work capability assessment. And there's three possible outcomes of that assessment. If your child's found fit to work, they need to sign on in order to, as available for work and actively seeking work in order to retain universal credit. Second option is that they're found to have a limited capability for work. That means they'll still get universal credit, the payments will not increase, and they'll have to take part in activities to get them more work ready. And then the third category is they're found to have not only a limited capability for work, but also a limited capability for work-related activity. And if that happens, then not only do they get universal credit on a long-term basis, but the payments increase quite substantially to about £158 a week from the start of the 4th month of their claim. Now, it may take longer than 4 months to get a medical decision, a medical assessment decision. So if it takes, say, 6 months to get the decision, what that means is that the extra money will be backdated to the 2 months to the start of the 4th month of their claim. So that's how it works if your child's not in education, but if they are in education, it's much more complicated and there's huge barriers to claiming. The problem is that under universal credit, there's a general rule, Regulation 12, that says you can't get universal credit if your child is receiving education. And then the law defines what's meant by that. So you're treated as receiving education if you're in university or other full-time advanced education. You're treated as an education if you're getting a course where you can get a maintenance grant or loan. And you're also treated as in receiving education If you're between the ages of 16 and the September after your 19th birthday and you're in full-time non-advanced education. You're also treated as receiving education if none of those apply. So say if you're age 20, you can be treated as receiving education if your course is incompatible with your universal credit claim and the work-related conditions that have been attached to that. So anytime someone claims universal credit, the work coach usually would attach some conditions, some things that they expect the claimant to do in regard to getting themselves ready for work. And if those are seen as incompatible with the course your child's on, and then that is another way that they can refuse you universal credit on the basis you're receiving education. So some 20-year-olds, they're not covered by the first 3 bullet points, but they could potentially fall foul of the last one. But not always. We think there's a strong argument that some 20-year-olds who are still in non-advanced education should be able to claim universal credit and not be treated as falling under this rule. Because for some people, particularly if they're in a life skills course, the course they're doing might be really flexible. They might not be following a set curriculum, and it may well be that the course provider is quite happy for them to take time out of the course to do whatever activities universal credit work coach wants the child to do. So if that's the case, why is it incompatible? Also, sometimes a work coach will switch off the conditions pending a medical assessment. They'll say, well, I can see your child's really severely disabled. I don't think it's really appropriate that I ask them to be doing all these things pending the medical. I'm just going to switch off the conditions temporarily. And if they've agreed to do that, if there are no conditions, then the course can't be incompatible with the universal credit claim. So if your child has reached the age of 20 or they're past the September after their 19th birthday and they're still in non-advanced education, it's possible you might be able to claim universal credit under the normal rules. But if that doesn't apply, or if your child is in advanced education or between 16 and 19 and in non-advanced education, you have a problem. You're going to be caught by this rule that says your child can't be paid because they're receiving education. So what does that mean? Does it mean that there's no chance of your child being able to get universal credit at all? Well, not quite, because there are some students that are exempt from this restriction who can claim despite being someone who's receiving education. So that applies if a young person's got children of their own. It applies if they're estranged from their parents and living alone and they're without parental support. But more importantly, from our perspective, it also applies to some disabled students. But the problem is how they've defined who's a disabled student. Now, I'm aware I'm reaching 11:30. I'm going to carry on because I've not quite finished the consultation. So I'm going to carry on with that. Hopefully you're able to continue to listen. And I'll also continue a bit longer dealing with questions after I've finished the content of the webinar. So hopefully you'll be able to stay on for a little bit longer. I'll try and make this as quick as I can. So the problem with disabled students and the exemption is how the exempt student is defined. So the rules say to be able to claim universal credit despite receiving education, you need to A, be on DLA or PIP, which is straightforward enough, but also, and this is the problem, you have to have a limited capability for work. Now, that doesn't mean that your child thinks they've got a limited capability for work, or that you think they have a limited capability for work, or even that their GP thinks they have a limited capability for work. What it actually means is that they have been put through a medical assessment called the Work Capability Assessment by the Department of Work and Pensions or the Social Security Agency in Northern Ireland, and they agree that your child has a limited capability for work. Fair enough, you think, okay, so what will happen is I make a claim for universal credit. I'm initially refused because they've not had a work capability assessment, but I simply ask the DWP to organise that so that my child can then be paid universal credit. Well, if only it was that simple. Unfortunately, lots of parents are reporting this catch-22 situation where they're being told, well, your son or daughter can't actually be paid universal credit or even claim it unless they're first put through a work capability assessment. And then when they ask to be put through a work capability assessment, they're told, well, we don't have to do this and we're not going to organise one because your child's not getting universal credit. They're not in the system, so we're not going to organise a medical assessment. It's completely outrageous, unacceptable state of affairs. Contact has been very unhappy about this for a period of time, and we were looking at campaigning to try and get this situation changed. The good news is that there is a workaround that can get around this problem. And that is because under Social Security legislation, you actually have a right to have a medical assessment. And the reason you do is because if someone's not fit to work, they basically are not working and paying any national insurance contributions, and therefore they have a gap in their national insurance record. And that could eventually come back to bite them in the future because they might find that they can't claim for any contributory benefits, and also their pension when they eventually retire will be lower because of this gap in their national insurance record. So the law says that if you're someone who's not fit to work, you shouldn't be penalised for that. And if you can prove you're not fit to work, the government will give you these national insurance credits. So how do the government decide whether you're unfit to work or not for the purposes of credits? Well, they undertake a work capability assessment, which is the same assessment as is used by universal credit. Now, the problem is they don't have a claim form for applying for credits, believe it or not. But what they do instead is they say, you can make a claim, fill in a claim form for New Style ESA. Now, New Style ESA, as we spoke about earlier, is a contributory benefit. So your child would fill in this claim form for New Style ESA. They've got no hope of getting the benefit itself, okay? But what they're doing is they're making a claim as just a way of trying to get a medical assessment and to prove they're entitled to credits. And they have a right to do that. And it's called, under the system, it's called a credits only claim for New Style ESA. What should happen is eventually you should have a work capability assessment organised. If your son or daughter shows that they have a limited capability for work, that not only means that they're entitled to protect their pension by getting national insurance credits, but they also have a limited capability for work for universal credit purposes. Although the medical was not carried out specifically for universal credit, it is binding. The decision is binding on universal credit claims. So at that point, your son or daughter does meet the two tests and a claim can be made. So if we take an example of Jo, she's still at school, she's on PIP, she wants to claim universal credit. She tries to claim, she's refused because she doesn't have a limited capability for work. She lodges a claim for New Style ESA. She should make it clear at that point she doesn't expect to receive New Style ESA. It's simply her trying to establish her right to national insurance credits. She has to submit fit notes as part of that process. After a really lengthy delay, there will be a work capability assessment organised. As long as Jo's found to have a limited capability for work, she goes back to the job centre, she makes a second claim for universal credit, and this time she meets those two tests. She's getting DLA or PIP, and she has a limited capability for work. So at that point, she should be successful and is awarded universal credit despite still being in education. The problem is it's not backdated. So the longer the delay in carrying out a work capability assessment, the more money Jo's lost out on, and that's simply unacceptable in our view. And that's one of the reasons we're looking to campaign to get these rules changed. So just to highlight a few issues. So remember, just because your child can claim universal credit potentially doesn't mean you should do so. If they are successful, any benefits you get for them as a dependent child would stop, it's not always a good idea. We offer a better off at 16 calculation to families on our helpline. We can work out whether a claim for universal credit or not is a good idea. Second issue, it's not always easy getting a credits only claim accepted. You have a right, there's no doubt about it, a legal right to get a medical assessment done. But a lot of DWP staff really haven't heard about credits only claims before. They're very sketchy about understanding what you're asking for. Lots of parents face barriers where they're told, oh, I'm not sending you out this claim form because your child's got no chance of getting new style ESA. Or if they do lodge a claim, it doesn't seem to be actioned. It seems to be put into a drawer somewhere and nothing happens about organising a medical. You have to be very directive. You have to be very strong in your dealings with the DWP sometimes to make sure that the medical happens. If you run into barriers, contact can help you to challenge that. So please come back to us via our helpline. And finally, just to say that the work capability assessment can take many months to organise, and that situation is probably only going to be worsened because of coronavirus. There's going to be a massive backlog of medical assessments. So it could take up to a year, maybe even, to get your child assessed, which is shocking in itself. But what we would say is, if possible, if you think you're going to be relying on a credits only claim for your child, try and get that claim in early. Do it before you even want to claim universal credit. So if you can get your, say, if you think you might want to claim universal credit for your child when they turn 18 and they're still going to be in education, make the credits only claim for ESA at age 17 then. That'll give you a year to try and get the work capability assessment done and the decision that your child has a limited capability for work before you actually need to use that as part of a universal credit claim. Making a claim for credits only ESA will not affect your child benefit or tax credits in the meantime. It's only the award of ESA or universal credit that affects child benefit and child tax credit, not the act of simply lodging a claim. Okay, that's all the content I intended to cover. I'm now going to have a quick look just to see what other questions we've had. There's been quite a lot of questions that have come in, guys, so I'm going to have a quick look through. So someone's asking in terms of means testing, so for, I'm presuming what they mean is for universal credit, what's the limit in savings a young disabled person can have so it wouldn't affect their benefits? Well, the way it works for universal credit is that if the young person has less than £6,000, it's not going to affect their universal credit claim. If they have more than 16,000, they will be refused universal credit because no one can claim who has capital above that figure. And if they have between £6,000 and £16,000 in capital, what happens is the universal credit is reduced. Basically, for every £250 someone has above 6,000, they lose £1 per week from their universal credit award. Dominique's also asking, their child has ASD, social anxiety, mental health issues, but at the moment doesn't get either DLA or PIP. They are 15 and a half. Would they still be classed as disabled? Well, under the current benefit system, they're not classed as disabled. I mean, they would need to establish an entitlement to DLA to be classed as a disabled child under the benefit system. And I really would recommend, Dominique, that, if you've not made a claim at all, that you do that now. Try and get a claim in for DLA for your child before they turn 16. Don't wait till they're 16 and claim PIP. Because if they get an award of DLA now, it means that while the PIP assessment is being waited for, once they turn 16, as long as they already have a DLA award in place, it means at least while they're waiting on a PIP decision, they're going to continue to receive DLA payments. Whereas if you don't do anything and wait till after they turn 16, you're not going to have any payments for them until actually a PIP decision has been made. And PIP decisions can take 3, 4, 5 months sometimes. So yeah, Dominique, definitely try and get a claim for DLA in before your child turns 16. So Linda is asking if a child's over 18 and not capable of completing a universal credit claim on their own, and there's no deputyship in place, can I still claim on their behalf? Well, you can help them to make a claim. I mean, there's nothing stopping you from assisting them, filling in the form alongside them, filling it in on their behalf. In terms of whether you can actually sign a universal credit claim and act on their behalf in terms of telephone calls and getting correspondence sent to you rather than them, that will only happen if you're their appointee. So if they're on DLA or PIP, then hopefully that's already been agreed. If they're not on one of those benefits, or if you're not their appointee for those benefits, you're going to have to make the case that they lack mental capacity to manage their benefits and apply to the DWP to be their appointee if you actually want to be the one that makes the claims on their behalf, that signs the claim forms, that deals with the benefit payments themselves. So Nadine is asking, how much money can I get my child to pay me when they are 16 and receiving universal credit in their own right? Does someone look into what the universal credit is used for? Well, there's no rules about that, Nadine. Obviously, some families would need or expect a young person who's got benefits in their own right to contribute towards some of the household costs. They might be asked to contribute towards food bills, heating bills, but there's nothing really setting out like what the rate should be. That's something that's seen as being, an individual decision to be made, really. Universal credit are not really going to come back and contest that, I don't think. I mean, I suppose the only issues are that if you're acting on someone's behalf, and receiving benefits, you have to be able to show that you're spending the money on their behalf. But as long as you can show that the costs that you're asking them to help meet are proportionate and fair, then I don't think you would have any problem there. But yeah, I can't give you any specific figures that would be reasonable for a parent to ask their child to contribute towards household costs. So Lynn is asking, my son turns 19 in January and he's attending college. What happens when he leaves in July? Well, yeah, when he leaves education, so if your child is going to be leaving education, as we said earlier, if your child leaves full-time non-advanced education, then any benefits that you get for him, like child benefit, child tax credit, are definitely going to stop. And really, you'll be able to claim universal credit. If he's not in education at that point, then you're not going to have to worry about these complicated rules about a credits only claim. You really should be able to get a universal credit just applying in the normal way. Emma's got a question just about this issue about national insurance credits. She's saying her daughter's been awarded limited capability for work. She's already been through the work capability assessment. She's getting universal credit, including the higher payments after month 4. How does she go about applying for the credits? Well, Emma, you don't need to apply. You will get them automatically, because every week that your child has established that they've got a limited capability for work and they're being paid universal credit on that basis, they'll automatically receive credits for their to protect their pension entitlement. Sonal is saying, what about employment and support allowance? Young adults above the age of 16 should be able to have this, yet in their experience, a lot of people are being refused ESA. Well, as I'd said earlier, I'm afraid, Sonal, that what you're describing would have been accurate 3 or 4 years ago, before universal credit came in. Once upon a time, it was the case that most young people above the age of 16 were able to claim employment and support allowance, normally income-related employment and support allowance. But I'm afraid that's simply not the case anymore, because that benefit has been replaced by income-related ESA for almost all claimants. employment and support allowance is very rare now as an option for a young person unless they've been working and paying stamps and is able to claim the contributory form. Okay, everyone, so time's really ran away from me entirely. I'm afraid we're coming up to 10 to 12. I know we've had lots and lots of questions today. I mean, there were, about 230 people signed up to the webinar, so that we've had huge numbers of questions, and I'm simply not going to be able to cover them all. So what I'm going to do is I will try and put together a sort of question and answer sheet that lists the questions and answers them, and we'll post that up on our website and via our social media next week. But for the time being, I'd just like to say thank you so much for taking the time today to take part in the session. I know that you're very busy. I'm sure some of you will have had young people who have been waiting quite breathlessly for results coming through. So yeah, I'm sure you've got a lot else to deal with. Thanks so much for taking your time. If you're looking for further advice or information on any benefit issue, please contact Contact's helpline, the details of which are on the screen just now. And just to remind you that when the session ends in a minute or two, you will be asked to take part in a very short questionnaire. Please, if you can you take a few minutes to do that? It's really valuable to us in terms of planning future events. Okay, guys, thanks so much for taking part, and I wish you a very good day. Okay, bye.